What patients need to know about pleural mesothelioma surgery. If you have mesothelioma and your doctor recommended that you do surgery, these are 3 of the main surgeries that are usually offered. Hey, I'm Deborah from survivingmesothelioma.com, and for almost 20 years now, we have been helping mesothelioma patients with the latest in mesothelioma treatment information. In today's video, we're going to explore 3 main surgeries that have been proven to improve the life expectancy of mesothelioma patients. And if you'd like a free copy of our Mesothelioma Surgery Secrets Guidebook, where we interview one of the top mesothelioma surgeons in the country, I'm going to leave a link in the description below. Now, let's take a look at the 3 different surgeries. There are 2 main surgeries for pleural mesothelioma and then a combined surgery for peritoneal mesothelioma. Let's start with pleural mesothelioma. The 2 main surgical options are extrapleural pneumonectomy, EPP, and pleurectomy decortication, PD. All right, number 1, extrapleural pneumonectomy, EPP. This is a major surgery where the surgeon removes not just the pleura, the lining of the lung, but also the affected lung itself, parts of the diaphragm, and then some of the heart lining. This surgery is typically recommended for patients with more advanced cancer. However, it is a very intensive procedure with significant risks. A study published in Expert Review of Respiratory Medicine in 2010 showed that while EPP can be beneficial for some patients, it comes with a high risk of complications and requires a long recovery time. All right, number 2, pleurectomy decortication, PD. Now, this procedure is less invasive than EPP. Here, the surgeon removes the pleura and then any visible tumors, but leaves the lung intact. PD is often preferred for patients whose cancer hasn't spread as deeply. A study published in Lung Cancer in 2014 indicated that PD has fewer complications and a quicker recovery period compared to EPP. More and more doctors are leaning towards PD because it's generally easier on the patient and survival time may actually be longer with PD. Both of these surgeries are most effective when they are combined with other treatments like chemotherapy and radiation. A review in the Journal of Thoracic and Cardiac Vascular Surgery in 2018 highlighted that these multimodal treatment can improve survival rates, especially when the surgeries are done in specialized centers. So you want to be sure to talk about multimodal treatments and therapies with your doctor. Now, let's look at surgeries for peritoneal mesothelioma. The main surgical treatment here is called cytoreductive surgery, CRS, and it's usually paired with HIPEC, or hypothermic intraperitoneal chemotherapy. So what is cytoreductive surgery, or CRS? So this surgery aims to remove as much of the cancer as possible from the abdominal cavity. So imagine the surgeon meticulously scraping away invisible tumors from various surfaces inside the abdomen, aiming to leave no visible cancer behind. A study published in the Annals of Surgical Oncology in 2006 showed that combining CRS with HIPEC resulted in a median survival of around 36 months for patients who had most of their tumors surgically removed. So then after the CRS, while the patient is still in the operating room, a heated chemotherapy solution is then pumped into the abdomen. So this is the HIPEC part of the surgery. This heated chemo bath circulates through the abdominal cavity, targeting any microscopic cancer cells left behind by the surgery. The heat helps make the chemotherapy more effective. Another study published in Seminars in Oncology in 2002 highlighted that this combination approach could lead to a median survival of 50 to 60 months. Of course, no major surgery is without risks. A study published in Cancer Treatment Reviews in 2012 pointed out that while CRS and HIPEC can have significant complications, the overall death rate from the surgery is relatively low when performed at experienced centers. So, to kind of wrap up, for pleural mesothelioma, we have two main surgeries: EPP, more invasive, higher risk, but potentially beneficial for advanced cases, and then PD, less invasive, fewer complications, generally preferred. And then for peritoneal mesothelioma, we have the combination of CRS, surgical removal of as much tumor as possible, and then HIPEC, heated chemotherapy to kill remaining cancer cells. Both approaches offer the best outcomes when combined with other treatments like chemotherapy and radiation, and performed by experienced surgical teams. This is called multimodal treatment. And remember, if you'd like to hear what one of the top surgeons in the country has to say in our exclusive interview on mesothelioma surgery, check out the link below. The interview is with Dr. Jacques Fontaine. He is an expert in pleural mesothelioma who specializes in robotic assisted thoracic surgery at Moffitt Cancer Center in Tampa, Florida. He is among the top-rated thoracic specialists, having been rated the #1 thoracic disease doctor in Tampa for 2021, 2019, and 2018 by Tampa Magazine. In the guide, we uncover all of Fontaine's tips on how to have a successful surgery if you have mesothelioma. And if you're looking for more information on mesothelioma, please visit survivingmesothelioma.com. All right, that is all for me today. I am wishing you the best of health, and I'll see you in the next video.